And to be clear, just for people watching, this study did look at patients who were not dealing with heart attacks or had dealt with heart attacks in the past. That's what Dr. Kahn is referring to when he says stable angina, chest pain that, again, not coming from an actual heart attack. But having said that, Dr. Makary, when a study like this comes out, I'm going to ask you, Dr. Makary, is it even ethical to perform, say, bypass surgery or put stents in a patient who Dr. Kahn just told me will probably do better without?
Mm-hmm. Well, let's be honest. The vast majority of people who have stents placed believe that they will live longer, even though the evidence shows very clearly that outside of an active heart attack, there is zero survival benefit. From all the experts, all the studies, it is now very clear. We used to think that so-called opening up the blockage meant you were automatically going to live longer. That was the old thinking. We now know the studies have shown no survival benefit. So I'll tell you, the doctors need to talk about that study. They need to talk about the long term. This idea of using language that's loaded, like, oh, you have a blockage and we're going to open it up. Well, you know what? Stents have their own complications. There's something called in-stent stenosis, where clots form inside the metal cage. Patients should know that ultimately, in the end, the benefit of these surgical interventions is to reduce the pain of angina or eliminate it, or it's for an active heart attack. Outside of that, if you're, as Dr. Kahn said, stable, healthy, and you have no active chest pain, no angina, you're not going to live longer for a stent. I asked one of our heart surgeons, what percent of patients who get stents believe that they are going to live longer? He said 100%, because the doctors are not telling them what they should be telling them about the survival implications.
And this is the power of suggestion, of course, and also when patients talk to other family members and they have the same experience, at least in terms of their perception of what's going to benefit them. Yet this study has the potential to impact so many, because more than 9.5 million people suffer with this condition in the US alone. And I know that the profitability is still a factor here, because when stents are put in, Medicare reimburses over $10,000 per procedure. And so is that the issue here?
Yeah, it will destroy hospital budgets. Cardiac procedures of stent and bypass are the #1 most profitable section of a hospital. #2 is usually the coffee shop. But #1 is still these heart procedures. So I am not seeing massive transformation from my colleagues. I've already referred. I'm a retired stent doc. I've put in 10,000 stents. But I do appreciate, although my safety record was exceedingly high, that this is a procedure that even the most healthy person can die from. And they should have the opportunity to say, of course I'll change my diet, I'll go to the gym, I'll lose the weight, and I'll take the pills.
Having a bypass surgery or getting stents, these are really, really big decisions. So if we've learned anything, it's get a second opinion, and certainly never rush to get a procedure or surgery unless it is a true emergency. In this case, if you are having a heart attack and your doctor says, we need to do this or you might die, you get it done, and that is important.
Everybody out there is empowered to start today, even if you don't have heart disease. Embrace these lifestyle changes of fitness, diet, good sleep, because they will add quality and quantity to your life. And that is the beauty of the ischemia trial.
No doubt about it, and we appreciate this focus on lifestyle measures. I'll also plug Dr. Makary's book one more time, The Price We Pay. Great read for anyone who wants to learn more about some of the dysfunctions in our healthcare system. Docs, thanks so much.